Dear friends, hi. This is a case of a 51-year-old woman who presented with abdominal pain after a surgery, and as an incidental finding, I noticed this hyperdense focus in the posterior aspect of the right iliac bone, and I would like to discuss it with you. There is a focal hyperdensity with some central calcifications like opacities. There are some changes around this lesion. There is an impression that there is a ground glass opacity around it, but anyway, there are no other aggressive findings. There is no bone expansion, there is no cortical disruption or endosteal abnormalities or scalloping or something like that. Fortunately, I have the previous CT scan, which was performed 7 years ago. This is the previous CT scan. There are some differences. If you can see, the lesion in the previous CT scan has quite smooth contour, and it is smaller with no other changes like the small central calcifications. So I will show you the new image again and just compare. This is the new image. The lesion is larger and there are some dense small calcifications centrally. I have in my archive a similar case with another patient who presented for some reason, but as an incidental finding there was a similar lesion in the left iliac bone, but it was not mentioned in the report. And this patient underwent a CT scan 5 years later, and look what was found. There is a lytic lesion here, compatible with chondrosarcoma. Okay, so this is another patient from my archive. Now let's go back to the current case and discuss it. So this is the current case, and very easily we can say that this could be a bone island or something benign like Enchondroma. Okay, but if we compare the previous CT scan, which shows this lesion here, which is smaller with no other changes, with this one, we may suspect that something is going on here. So the teaching point is that we must not ignore lesions like this. They may represent Enchondromas, and it is well known that Enchondromas have malignant potential and may transform into chondrosarcoma. Like in this case I showed you previously. So it's a good practice to mention lesions like this in our reports for close follow-up or further evaluation. And by the way, I found that there is another smaller lesion on the other side, on the left side, just here, which is again little bigger and denser in comparison with the previous examination. Here is the previous examination. It's slightly smaller and not so much dense. And here is the current CT scan. Dear friends, thank you for watching. If you like my videos, please subscribe to my channel. So see you the next time soon.